Hi, I'm Dr. Mohammed Tokir. I'm one of the gastroenterologists at the Conquest hospital. I would like to welcome all the trainees to the gastroenterology department. We have a team of 4 gastroenterology consultants who do on-ward and off-ward rota. Basically, we'll have 2 consultants. One will be the ward consultant and one will be the outlier consultant. The outlier consultant is also responsible for taking referrals from the surgical team, gynecology and the acute assessment. We also provide an in-read service to the acute assessment every morning as a part of consultant ward round.
This is also led by a team of 3 registrars, and we have a group of 1 FY1, 2 FY2s and 1 core medical trainee on our firm, so we are relatively well staffed. We like to think that we're a very supportive group on the whole. We like to make sure our juniors have the right clinical opportunities and support and teaching to back that up.
Hello, my name is Isaura Alba. I'm one of the FY2s in the Gastroenterology department at Conquest Hospital. So far I've enjoyed a lot my rotation in gastroenterology. We have the opportunity to participate in the ward rounds. We cover 2 wards. One is Wellington ward and the other one is Disham ward.
My name's Kaitek. I'm an FY1 in Gastroenterology at the Conquest Hospital. My typical day starts about 8:45 on the ward, getting the ward list ready with all of the patient details, diagnoses and plans and investigations. So I update that each day with any new patients that are on and update it with any new information about old patients. And then we go on the ward round with either consultant or registrar. Some days in the week it will just be me on my own or with a SHO, but it's quite rare to be on your own in this job. You're normally quite well supported. After the ward round, the rest of the day is spent kind of executing the jobs that were generated on the ward round. All sorts of investigations, bloods, referrals, examinations, discharge letters when they're ready to go home.
Hi, I'm Lourdes. I'm the ward matron, Wellington Ward, Gastroenterology unit here in Conquest Hospital. Nursing and the doctors work very well, providing holistic care to the patient with gastro problem. We are 20 bedded. We have 2 bays, 1 female and 1 male, and 8 en-suite side rooms. We provide care and communication is our key. We always have one rule in Wellington Ward that if we have an open communications and deliver it with a smile.
It's a medical job, so you do 1 in 8, so every 8 days you're the F1 on call for the hospital. If it's during the week, you do your normal day job until 5 p.m, and then you're the on-call F1, finishing any tasks that other medical teams haven't been able to finish, or answering the bleep for nurses who are concerned about patients, and then escalating as necessary. You do, I think, 2 or 3 weekends in a 4-month rotation on call, covering ward jobs, reviewing bloods, reviewing patients that the day teams have asked you to review over the weekend, and also answering bleeps. F1s in medicine don't do nights.
As the SHO in medicine, you'll do an on-call shift once a week, so that usually involves you being in the hospital, carrying an on-call bleep from about 8:30 in the morning till about 9 o'clock at night. You're usually based upon the acute assessment unit, clerking in patients from the medical take. You'll also be responsible for accepting referrals to come in either under medicine or under the frailty DME take. Whilst you're on call, you also carry the crash bleep, so any arrest calls or emergencies that you need to go to throughout the hospital, you'll be required to attend those.
Sometimes you have to do clerking in the emergency department. That's a very good mix because you're exposed to other patients, and sometimes you work together with the gastro team or sometimes with other teams. And then, I mean, in general, everyone is very supportive and they help you a lot when you are not sure about what's going on with the patient.
You do about 1 on-call a week, and then you'll do a weekend one in 4. And the night shifts, you'd probably expect to do 2 or 3 per rotation.
Hi, my name is Myra Mendoza. I'm the matron here at the endoscopy unit of Conquest Hospital. We have 2 procedure rooms. We do colonoscopy, flexible sigmoidoscopy, also gastroscopy, and we also do 2 ERCP and 2 bowel cancer screening program lists every week. We are a friendly bunch. I believe we do have a supportive and friendly environment for our trainees.
Hello, my name is Dr. Mark Whitehead. I'm a consultant gastroenterologist and also clinical tutor for the Trust. As an endoscopist, I welcome you to the endoscopic department. When you first start here, if you come and see us to find out the lay of the land, it was very helpful. And also when you do ask for urgent referrals, come and see us and talk to us, as that helps get things done quickly.
We promote very actively you getting involved in clinics, and we like you coming over to the endoscopy unit to observe endoscopy lists, so you can see a variety of different endoscopic procedures. On top of that, your clinical experience on the ward will range from really acute cases to very simple cases. So I think we're pretty much an all-rounded kind of specialty here, where you see a lot of everything, and we really encourage you to try to just get stuck in.
Obviously the main priority is to stay on the ward and not compromise patient care, so ensure there's a good level of staffing on the wards. But if you ever feel you've done all the jobs and there's sufficient people on the ward, you're more than welcome to have a word with one of the consultants if you feel like going up to endoscopy. I know I've done it 1 or 2 times just to see what it's like. SHOs are encouraged to cover in for clinics as well, so today I'm actually doing a clinic this afternoon.
Hi, I'm Nida Castro. I'm one of the sisters here in outpatient department. We have a lot of gastroenterology clinics across the week held by different consultants and registers. We have a very busy department, so there are a lot of opportunity to learn with a friendly and supportive outpatient team.
In terms of teaching, we have IBD MDM, where we discuss complex inflammatory bowel disease patients. There is opportunities for PACES teaching because all 4 of us are very keen to be involved in teaching about PACES, and we have done successfully in the past with a lot of positive feedback from the trainees. And we are a part of teaching during simulation training and also teaching lectures for the core medical trainees on different gastro-related topics.
We like to also implement a lot of micro-teaching because obviously juniors have a very busy day, so we try to get those little minutes where you can put in some really good bits of teaching, not necessarily in the lecture base, just small chats and discussions about things.
We do provide plenty of support during audit processes, and like currently, as I mentioned, there's a couple going on at the moment. We always are on look for any interesting cases that we can present, any interesting audits that we can do.
On top of that, we've got a range of different radiology MDMs, surgical, gastro MDMs and cancer MDMs. So they get a lot of exposure to radiology and different pathologies throughout their time here. We're very multidisciplinary, so they'll be exposed to nutritional aspects of gastro. Our dietitians, we've got a fantastic dietitian linked to us at the moment, Bryony Campion, and she takes them through a lot of the nutritional aspects of support for our patients as well.
It's everyone's job to try and teach if they can. If your F1 has a question about something, then try and talk them through that area. Again, we'll have medical students as well, both from Brighton and King's. So again, it's just trying to get them involved, trying to show them as much as they can, because obviously you're trying to prepare the next set of doctors for next year. The rota is now all done kind of electronically, and so we have our health roster kind of login and password, so from that you can see your whole kind of rota, see who's covering the ward at what point. You just submit it all electronically online, and that can be done both at work or at home, and then it all just goes to the rota coordinator. They check, as long as you've got sufficient cover on the ward, then they'll approve it.
If there's something you need to learn or something you need to inquire about, we're here to answer and help you with that. And I think that goes to, that message applies actually to everyone within the gastro department, our nurses, dietitians, healthcare assistants. So we like you to think that actually this is just a bigger extended part of your family, and will support you in any way, both for, that provides better care for our patients and allows you as junior doctors to develop.
Definitely enjoyed it because the team is well supported, it's well staffed, and it's got a very friendly atmosphere.
I've learned a lot we are exposed to a lot of patients with very simple illnesses to very complex ones. And in general, I've never felt like I'm alone. The registrars have been very supportive, and I think that's what makes the rotation very enjoyable.
We look forward to seeing you in the department, to have a wonderful time here, and I hope you learn a lot with us.